Good afternoon, everyone. Let's welcome our speaker, Mr. Justin Lee and Richard Pavia from Stendo. They will be conducting the presentation. So let's just give them a warm welcome.
Thank you, everyone. So, thank you, Hershan. As she said too, my name is Justin and I'm from Stendo Asia. We also have Richard Pavia here, who is a representative from Stendo France.
Yes. Hi, everybody.
Yeah. So let's move on to what we're going to talk about today. So we will start with the history of Stendo and what is Stendo pulse therapy. We'll also then go on to talk about our patent, our certificates. Of course, we'll also talk about our principle of action, vasodilation through the nitric oxide pathway, as well as the clinical studies that were conducted and also some main indicators. And last but not least, we'll also show an image of how Stendo works, like a Stendo session. To start out the conversation, let me ask Richard a question. What is Stendo and how did the name come up? Can you also talk a little bit about the history of Stendo?
Yes, so the name Stendo is based on an acronym. The first part is ST, stimulation, and endo is endothelium. Endothelium is our inside cell layers that we have in all our vessels. And in 98, the three doctors were able to explain what the vasodilation process how is functioning, because before it was just one vasodilating factor, but it was a black box without knowing how the process was. And those doctors were able to prove that at the end, these vascular adaptation process is just one mechanotransduction. It means one mechanical reaction, is because our blood flow is changing the rhythm, is changing the pressure, is changing the shear stress, what they call shear stress, that the endothelium will create specific molecules and adapt the vasculature to the heart and the blood pressure needs. So this is the main point for us, because we are here in the medical field and we had the medical background to develop the product. And Stendo has been developed from engineer, of course, but the first idea is related to three cardiologists, which had the idea to say, but if our body is reacting with a mechanical stimulation, how can we invent an external tool to be able to send the same message to the body? And that's the reason why we started in 2011 and 3 years of technical development. And then we achieved at the end to have the C medical mark and to be able to prove that our external suit is able to transfer to the body the same message. That's the reason why these pulse therapy new rehabilitation technique is a natural one. It's not aggressive, it's a natural, because we are talking about exactly the same language, the same signal to the body. So next, please. So I said we achieved the goal. So we go through the C medical mark. We had to do clinical studies. And at the end, if you go once again, next.
Yeah.
Yes, for you.
Yeah, so to add on that, other than the CE certificate that was obtained by Stendo France, we also got our Singapore medical device registration this year, as well as the Hong Kong medical license, the certificate of listing in Hong Kong as well this year. So maybe we can go into some detail with the CE certification, in particular with the shear stress, as I see in the scope that it says.
Yes. So if we see what is written on the identity card, on the official medical passport of this device, the scope is compression, decompression, non-invasive, so natural device. It's applied on the lower part of the body, legs, tight, abdomen. So we will be able to stimulate, so abdomen, legs, calf, where we have a big volume of blood, and we are able to reproduce on this area the natural physiological pulsation and physical shear stress. And to do this, our device is cardio-synchronized, meaning that each time there is a transfer of a compression and decompression, this will be always in the diastolic period, means there is no negative interference with the cardiac activity. So in this part of the body will have the double of the pulsation, and this is the secret of our new rehabilitation technique, to be able to reproduce in a natural way these mechanical forces.
Okay.
Yes. Yeah.
So I heard nitric. So I'm wondering if you can also explain something more about the nitric oxide that will be produced in our vessel while using Stendo.
Yes, nitric oxide is present in our body in 3 areas because it's the same gas but produced in a different way. We have nitric oxides in our immune system, mainly produced by macrophages, and we will see when we have a local inflammation that there is a vasodilation, redness. These local vasodilation is produced by macrophages, is our immune defense. We have also inductive nitric oxides in our brain, but what is regarding Stendo is the vascular nitric oxide, means enos, endothelium nitric oxide syntax, and it's produced by our endothelium cells. And how it works, it's very simple, because those cells, if you see, they are in direct contact in the blood, and they can feel the difference in the laminal flow. As soon as we change our physical activity, we change our blood rhythm, we change our blood pressure, and we change our blood speed. And these endothelium cells are working like sensors. And as soon as they feel this mechanical stimulation, they will have a biochemical reaction creating locally one gas, very short duration of this gas, a fraction of a second. But this gas is called nitric oxide, is the messenger to send to the muscle structure, a message to dilate and to adapt the size of the vessel to the body's needs. So the biochemical process is quite complicated, but at the end, the most important thing for us is that the reaction is local. Nitric oxides you cannot measure, like doing simple blood analysis. So the duration is very short, but what is very interesting with our new rehabilitation technique is that these physical reaction starts locally, and then you have a global reaction. So the main message today is that usually rehabilitation focuses only on the symptoms directly. I have a pain, I have a problem on the knee, so I focus with different techniques on the area. And here you have an additional tool with a more global impact, effect. So these physical reaction, you start with an external suit, you have a vasodilation, and of course you can also have positive reactions on the blood pressure. But I think we have to speed a little bit because we have 5 minutes less, so we have to speed, Justin.
Yeah, so you talk about a lot of vasodilation and increasing the blood flow. So how did you assess these physical reaction in your case with the body at rest?
Yes, you should perhaps change the slide.
Yep.
So the first clinical study was done to assess this microcirculation, and we assessed this in the international assessed system, and we changed it, we assessed it with FMD, so flow mediated dilation, and we and also with the acetylcholine test, both together. This study is published, is on PubMed, and we were able to prove that there is not only a local reaction, but also at distance. And so this is the first study we have been able to prove. And what is interesting also with our device, because as you see on the picture, the vasculature is overlapped, is mixed, and we have different pressures in the vessel. So we, after the first development of the device, we were able to see that with the reduction of the pressure, we were able to also focalize and to focus on lymphatic system. So if we can speed a little bit, we have another study on lymphedema and the congestion protocol compared to Pulsotherapy. And we had also very positive results. And the new thing in the in the lymphatic stimulation is, if you are going next, Justin, this is the main result we were able to prove that without with this new technique, we don't have dermal backflow. It means that the compressor is very gentle and adapted to one inflamed lymphatic system. And this is the main side effect that we can avoid with this technique. So we had some clinical results also on very severe, for example, lipodema stage 4. In those cases, the volume reduction is not the first target, but the increased walking distance and the better quality of life of the patient were the main target. Let's go. Once again, we have 2.5 minutes. And of course, when you increase microcirculation, when you are able to detox the tissue and to have a good draining effect, you can also have indirect healing effect. So the next direction rehab direction we had is also on some healing problems. And of course, if we are talking about microcirculation impairment, we need to talk about also diabetic, not Justin, because diabetic is the problem, the chronic illness where you have two big problems: microcirculation deficits, neurodystrophy, and also ulcers risk. So let's go next. We have 2 minutes. We see on some ulcers on elderly people how in a couple of weeks we increase immediately the vasculature structure. And as soon as you increase the vascular efficiency, you can then, and a second target, also targeting the healing. And of course, this kind of healing is very long to achieve, but at the end, you see the difference between, once again, a normal leg and a better quality of the skin. Of course, then we had also first diabetes testimonials because they are using our devices. And regarding diabetes, I think there is once again one additional slide, Justin. No, we have lost one. There is one regarding the study, but we have conducted a study on 40 patients, and we will have soon one published study on the efficiency of diabetes patients. So once again, Justin, the question is for you if you want, because I think we have no time.
Yeah, I don't think we have much time left, so I guess I will just conclude our presentation. So with a lot of points that Richard presented, Stendo is an innovative, natural and safe medical equipment to be used by professionals as well as home use. So it is a new way of seeing the rehabilitation and maintaining a good health. So rather than treating only locally, the Stendo Pulsotherapy also treats it, has a global effect on the patient's entire vasculature, on tissues, and also the whole entire body. So Stendo is a new treatment to also improve the vascular health and is supported by different clinical studies that Richard has already presented. For example, like circulation impairment, chronic lymphedema, healing problems, and will also soon be approved for diabetes vascular prevention as well. So last but not least, other than professionals or medical purposes, Stendo can also be applied in other fields like sport and well-being. So our newest product, V4, as shown in the presentation, is a more compact version, which is also suitable for everyone who treats health as a priority. And this concludes our presentation, and we hope to hear from you all soon. And here is our contact information. Thank you, everyone.
Hey, Justin and Richard, thank you so much for the wonderful presentation. So guys, if you have no question, is there any question on, is there any questions? If there's no questions, please feel free to, contact Richard and Justin via the business matching service. They are available online, and just connect with them and you can take the meeting further. So without any further ado, let us thank Richard and Justin once again, and we'll end the session now. Thank you.
Thank you.
Thank you. Bye.
Thank you.